Up to 90% of the Ebola victims will die without early diagnosis and medical intervention. These early diagnosis and medical interventions are critical to reduce fatalities from the Ebola virus, but it should be considered that the early prevention test kits are reliable and rapid. Current detection methods are expensive, time-consuming, and utilize complex instrumentation and chemicals that require uninterrupted refrigeration, which are not available in the countries that are most affected by this epidemic, such as Africa. Given this problem, Olivia Halisi, a 17-year-old from Connecticut who became interested in Ebola during 2014 outbreak, set foot in developing simple Ebola detection platform that can be stored and transported without refrigeration. Objectives of developing such new technology is to provide cheap but reliable Ebola tests, to detect Ebola virus fast, and to develop new technology that does not require refrigeration and can ease transportation of data. Hence the rise of the affordable test for Ebola, the Ebola assay card. Before I get into discussion of the wonders of the Ebola assay card, we should look into the overview of an Ebola epidemic. Ebola is a hemorrhage fever that targets the different organs of the body that mostly something to do with the immune system. Symptoms and conditions varies with time and days, and these includes inflammation of throat and mucous membrane. Tongue becomes so red, formation of white blisters in the skin, internal hemorrhaging, and blood clotting. And this is caused by the Ebola virus as seen in the image. Having said this, we don't want to reach this point of symptoms and conditions. That's why there is a need to develop new technology of detecting patients with positive Ebola condition before it can spread. Studies have shown that early diagnosis and medical intervention is key. This prevents future epidemics by 50%. The idea is to create simple rapid tests for Ebola that utilizes simple instrumentation and chemicals, hence the Ebola assay card. So how does Ebola assay card works? As stated in Olivia's research entitled Temperature-Independent, Portable and Rapid Field Detection of Ebola via Silk-Derived Lateral Flow System, Ebola ELISA reagents were embedded in silk fibrone. Silk film-embedded Ebola ELISA reagents were used to construct a 4-channel paper-based fluidic detection card with colorimetric reagents positioned to create timed, visible detectors of Ebola antigen. The methodology involves first the fabrication of silk fibrone into thin film, then formation of channel fluidics, test strips, stabilization of Ebola ELISA detection, and characterization of test strips and the test run. To run a test, 30 microliter drops of water were used to dissolve the silk-embedded reagents, initiating a timed flow towards the center detection zone, where a positive yellow result confirmed presence of Ebola. The mechanism involves: one side, water is added to dissolve Ebola ELISA reagents. One side, the serum sample is added, which can be a blood. Then both of them will travel, mixing with reagents in the paper, and when both ends will meet at the center, blue-colored test result means negative, yellow-colored test result means positive. The reagents embedded in silk fibrone is an established test for Ebola. The interesting part of this cheap test is to use silk, which makes the reagent stable even in room temperature. The product and the research is revolutionary and novel that has these following advantages. It is temperature independent, so no heavy refrigeration is needed. It is rapid. A test is good for 30 minutes only. It is simple and inexpensive, costs $25 per test, and uses silk that has stabilizing properties, allowing for room temperature storage for long as 2 weeks. This Ebola detection platform, based on proven chemistry, has the potential for applicability for other diseases including HIV, Lyme disease, yellow fever, and dengue fever. This study is relevant in the Philippines because Philippines is at risk, since few Philippine monkeys have Redstone bola virus that can evolve to be lethal to humans. The test kits can be applied in travel checkpoints, communities, and measured to test people before they can show symptoms. And if they are positive, they can be isolated early on before they can become epidemic. The relevant patent for this study is the immunodiagnosis kit for detecting 4-type dengue virus and is one antigen. The kit is based on the detection kit double antibody sandwich ELISA method, just like what the Ebola assay card was made of. Thank you for listening. I am Masangya, and this is the Ebola assay card.